Well, my friends, this is a case of a girl age about 17 years. 17 years girl having pain in the middle of the abdomen around the umbilicus. Around the umbilicus. Duration, the present age is 17 years, but the duration of the pain since childhood. ছোট থেকে হচ্ছে বললেন, ছোট থেকে হচ্ছে, for which she had treated with varieties of doctors and at varieties hospital, but not permanent relief. The pain is not severe. The pain is not excruciating. The pain is not severe cramping. The pain is not maddening. The pain is not violent, but a vague pain. সব সময় একটা বিরক্তিকর, a nagging pain, monotonous pain. Since childhood, the girl has been suffering. So it has been written by my junior, pain in the umbilical region since childhood, which aggravates at eating after. এই জন্যে আপনি নিয়ে এসেছেন, এটাই মেন কষ্ট। এটাই ডাক্তার জাকিরকে বলেছে। ডক্টর জাকির, হি প্র্যাকটিসিং অ্যাট বহরমপুর, এ ভেরি নাইস ফেলো, এ গুড প্র্যাকটিশনার, এ ফলোয়ার অফ মাইন্ড। So Dr. Zakir brought the patient to me, and the main complaint is pain in the umbilical region since childhood. There is also dysmenorrhea, there is also leukorrhea, and there is involuntary urination, and the urine is very offensive, is found, and burning. This girl is constipated, urine burning, scalding while passing, and very offensive. There is great falling of hair and sensation of a ball in the inner parts of the body. She is highly irritable, consolation aggravates, sadness, etc. Symptoms are found. Now the medicine is very correctly, our junior physician Dr. Asmaul has selected Cipia. Thank you, Dr. Asmaul. Your selection is correct. So now I do like to describe the diagnosis of the case. What is the diagnosis of the case? None of the allopathic physicians surely and confirmedly claim that it is a case of chronic appendicitis. This is a case of chronic appendicitis, my friends. You know the acute appendicitis, many of the physicians are well acquainted with the acute appendicitis, which is very common and belongs to one of the important and serious diseases, belongs to acute abdomen. Having the symptoms pain, nausea, vomiting, sometimes sudden rise of temperature. The patients are generally constipated, and there may be severe agonizing, cramping, maddening pain. There may be tachycardia, pulse becomes rapid and relatively more than the rise of temperature. There may be palpation of the abdomen. There may be tenderness and rigidity of the abdomen. There may be pain in the left iliac fossa when gives pressure, pain at the opposite side of the abdomen, which is known as rupturing sign. So all the symptoms of acute appendicitis are very clear, lucid, and known to every physician. The main three symptoms are togetherly called pain, vomiting, and nausea. So acute appendicitis. But what's about the chronic appendicitis? Pain lasts for many years. So, pain, vomiting and temperature, the three cardinal symptoms of acute appendicitis is known as Murphy syndrome. Dr. Murphy discovered or identified these three symptoms are the cardinal or guiding symptoms of acute appendicitis: pain, vomiting and temperature, PVT. Acute appendicitis, in many cases of acute appendicitis are curable by homeopathic medicines and by conservative treatment method, rest, etc. But sometimes there may be obstructive appendicitis which needed operation. Otherwise, it is curable and manageable by rest, conservative and treatment. Now the chronic appendicitis, the subjects are generally young girls. This is an young girl. This is an young girl. Young girls are the main victims of sufferings of chronic appendicitis. And there is a vague pain in the abdomen which is more often accompanied at the umbilical region or right iliac fossa. Definite localized pain may be absent and vague pain may be found around the umbilical. There may be dyspepsia, vomiting, etc. and constipation is a common accompanied symptom. Scalding or burning pain on micturition which mimics the physician as uterine colic and is often misguided by the physician. So this is no doubt a case of chronic appendicitis. প্রস্রাবের সময় জ্বালা করে, মেয়েটার কনস্টিপেশন আছে, অনেক দিন ধরে ব্যথা হচ্ছে ঠিক চারিদিকটায় পেটের, ডান দিকে বাঁ দিকে বেশি কম্বজ, ডান দিকে বেশি কম্বজ. So the students, the physicians have clear idea about the practice of medicine, surgery, gynec, all the symptoms of this girl corresponding chronic appendicitis. See the textbook of surgery about chronic appendicitis, all the symptoms of this girl is clearly mentioned. Young girls are the main victims of these conditions. A vague pain in the abdomen, which is more often complained at the right iliac fossa, probably the earliest symptom in majority of cases. Definite localized pain may not be found. See, vomiting may be found. See, constipation is a common accompaniment of these conditions, and burning pain during urination, all symptoms of this girl is found from the knowledge of surgery. The girl is also giving the symptom, the swelling of the foot. See, this is another clinical condition. The bilateral swelling, দুই দিকে সমানভাবে বুড়ো আঙুলটার পাশে ফুলে যাচ্ছে, তার সাথে সাথে পাশের সেকেন্ড ফিঙ্গারটা খুব বড় আকারে বেড়ে যাচ্ছে. This is the condition in surgery known as hallux valgus. This is the condition of the surgery is known as hallux valgus. The metatarsophalangeal joint, the first metatarsophalangeal joint become prominent হয়ে গেছে মেয়েটার, and the second toe becomes a hammer-like, ফুলে যায়, and this is known as hallux valgus. I am showing from the surgery book. This condition is known as hallux valgus. The great toe is abducted at the metatarsopharyngeal joint. The inner portion of the head of the first metatarsal bone becomes the main subject which becomes prominence. This condition is usually bilateral. দুই দিকে একসাথে দেখা যায়, এখানে আমরা দেখলাম। However, these figures or symptoms not necessarily important for our prescriptions. We have seen the now there is no medicine for appendicitis, chronic appendicitis in homeopathy. We have observed there is sadness, gloominess, melancholia, abundant leukorrhea, painful menstruation. The patient subject is chilly, sheet beshi. There is involuntary urination, burning urination. There is obstruction sensation in the throat, constipation, great falling of hair, চুল উঠছে খুব, চুল পেকে যাচ্ছে, falling and premature graying, sadness, irritable, consolation aggravates, রাগ বেশি না কম? রাগ আছে, মেয়েটি রাগ আছে। So irritable temperament. So all symptoms go in favor of sepia. Even the diagnosis is a chronic appendicitis, hallux valgus. So our prescription is, and not only that, the urine is very offensive. প্রস্রাবে গন্ধ থাকে না বললে? ঘন ঘন করে এবং গন্ধ থাকে টয়লেটে গেলে, বাথরুমে গেলে। So urine is intensified, excessive urinous order. Sometimes there is involuntary urination in bed. Sepia is a great important medicine for nocturnal urination. So all symptoms are corresponding to sepia. Urination involuntary, offensive, sometimes in bed, constipated, mentally sad, gloomy, melancholic. Great falling of hair, premature graying of hair, sensation of as if ball in the inner parts of the body, constipation, profound leukorrhea, painful menstruation, chilly patient, sheet beshi. So what not for sepia? এর পরেও যারা 5টা ওষুধ মিশিয়ে দেয়, পলিফার্মেসি করে, মশলা মুড়ি বানায়, কী করে করে আমরা বুঝতে পারি না। ছবির মতন যেখানে একটা পিকচার আসে, এই মেয়েটিকে যদি একবার চেনা যায় ছবির মতন, আর 10টা মেয়েকে বলবো এই মেয়েটির নাম হচ্ছে আউলিয়া। এবার হাউলিয়া, মাউলিয়া, কাউলিয়াকে দেখি কি বলবো যে এটাই আউলিয়া? যদি ঠিক মতন চিনতে পারি, তাহলে চেনার ক্ষমতা, এই পর্যবেক্ষণ করার ক্ষমতা, এই অবজারভেটরি পাওয়ার ইজ ভেরি ভেরি এসেন্সিয়াল টু দ্য ফিজিশিয়ানস। যার জন্য দরকার ঠিক মতন স্টাডি অফ ম্যাটেরিয়া মেডিকা এবং পিকিউলিয়ার, আনকমন, স্ট্রাইকিং ফিচার্সগুলো জানার জন্যে এবং আজেবাজে সিমটমসকে বাদ দেওয়ার জন্য, ডায়াগনোসিস করার জন্য, প্রগনোসিস করার জন্য, ম্যানেজমেন্ট জানার জন্য, স্টাডি অফ প্র্যাকটিস অফ মেডিসিন, সার্জারি, গাইনোকোলজি, anatomy, physiology, etc. So let's prescribe sepia and let's see the result. I shall share you, my friends.